All right. It is 12:01, so we'll go ahead and get started. Thank you so much for joining us today. We're glad to have you all. Today we're talking about the 1915 I services, what they are, how to access them, and how they support people with IDD, mental illness, and substance use disorders. This webinar is part of Monarch's Mental Health Awareness Month campaign, which is titled Feel It to Heal It. It's all about recognizing and honoring emotions instead of avoiding or minimizing them. During the campaign, we are offering printable resources, and they're all focused on self-care, managing emotions, recognizing the signs, while also helping people explore ways to access care and connect with the support available throughout the state. I want to also let you know that we will have a live Q&A at the end. So if you do have questions throughout the meeting, feel free to put them in the chat and we'll try our best to address all of them at the end. We do have over 200 participants today. So if we're not able to get to all the questions, then we will have the contact information for the presenters today, so you can reach out directly. All right, we'll get started here. So a few housekeeping things before we get started, just to help the session run smoothly. We do have everyone muted, and please keep yourself muted just so we can minimize background noise. Like I said, questions are always welcome and we'll address them at the end. Video is off for privacy reasons, but the webinar is being recorded and we will put it on our website after the meeting. And let's see, we're going to get started with a poll. So let me get that going. For some reason, it's not wanting me to be able to pull it up. It's being difficult. Lori, do you have the option to be able to pull up the poll on your screen?
I don't.
Yeah, I don't either.
Jen, I think it's all right. We can move forward on
edit
it.
Okay. So a little bit about Monarch before we dive in. We have been serving North Carolina since 1958, and we support more than 27,000 individuals annually through a range of services, everything from outpatient therapy and crisis care to day programs and residential services for people with IDD. Our network actually spans 46 counties in North Carolina, and we recently expanded into Rhode Island, which is really exciting. We are accredited by the Joint Commission, which signals the highest standard of care. So we go through rigorous assessments every year. With our statewide reach and integrated approach, we're deeply familiar with how the 1915 I services work in real world settings. So we're happy to bring you that information today. At this time, I'm excited to introduce you to our presenters. They are the Vice Presidents of Care Management, Anna Marshall and Leigh Daughtridge. Anna is focused on IDD and tailored plan, while Leigh is focused in behavioral support. And today we're excited because they both bring us valuable insight and experience to today's discussion. So without further ado, I will go off camera and pass it over to Anna and Leigh.
All right, thank you. Good afternoon. Thank you for joining us. And for those of you that may have heard about 1959 and here to get additional information, or this is new, our intent is to make sure that we continue to spread the word of new services that are available. And in North Carolina, the Department of Health and Human Services made a conscious decision to add additional services to the Medicaid state plan for people receiving tailored plan Medicaid, also formerly known as the LME MCO. Those are Alliance, Partners, Trillium, and VIA. There are 5 services that have been added. Those are community living and support, community transition, individual and transitional support, respite, and supported employment, which also includes IPS. And as we talk about the services, we then want to talk about, well, who's eligible for these services? Next slide. Thank you. So the eligibility for each service varies based on the service. But the eligible populations include beneficiaries with intellectual and developmental disabilities, traumatic brain injury, serious mental illness, serious emotional disturbance, or severe substance use disorder. And that need is based on criteria that was set by the department. So when we look at community living and support, this is a service specifically for those with intellectual and developmental disabilities and traumatic brain injury. And the criteria includes, it's called a functional deficit, but really that means that someone just has a need in an area that they could build skills. And can the person benefit from that skill acquisition? For example, self-determination, independent living, or they can benefit from assistance in monitoring a health condition or living skills. The service community transition is for people with intellectual and developmental disabilities, severe mental illness, substance use, and traumatic brain injury. If someone is living in an institutional setting and is ready and wants to move back to the community, moving into an apartment or a setting of your own can be expensive. So community transition offers funding for initial setup expenses and items. The service individual and transitional supports is for youth with behavioral and substance use issues, as well as adults with severe mental illness. And they need to have at least one area in what is called an instrumental activity of daily living. And really, that just means they may need help with meal preparation or maybe finances. Respite is available for those eligible in intellectual and developmental disabilities, for children and youth aged 3 to 20 with behavioral health and substance use, as well as traumatic brain injury. And the eligibility is for someone that really is unable to care for themselves in the absence of their primary caregiver. And then supported employment. And supported employment is offered to all disabilities listed, age 16 and up. And the criteria is that the person wants to work, but maybe they've had a situation where maybe they can't get a lot of hours. So it's what they call underemployment. Or maybe they've tried a job and they have consistently, it hasn't been successful. Or maybe the person has educational goals that relate to employment goals. There is one thing to note. It is not required for the person to meet institutional level of care. And that is something you may see in some of the waivers in North Carolina, but that is not a requirement for these services.
All right, so now what's the process? How do you get someone connected to 1915I services? So it's a 6-step process, and I'm going to walk you through each of the steps. So the first step is identifying the need. So they go to a provider, they're talking with that provider, and that provider says, hey, I think 1915I services would benefit you. Maybe it's one of the ones Anna just listed out. Let's use IPS for an example. The person wants to work, so the provider says, I think this would be a really good fit, but your care manager is the one that needs to get you connected to that. So then that provider is going to link the person back to their assigned care manager, who's going to move into step number 2. And step number 2 is the assessment. And the care manager is going to complete the 1915I assessment, selecting the most appropriate service or services to meet the person's needs based on the responses to the assessment questions. We have a slide next that's going to talk a little bit more about assessment, so we won't go too far into that just yet. Step 3 is after the assessment has been completed, the care manager is going to send that assessment to Caroline, who has contracted with the department to do an independent evaluation. And while waiting for that independent evaluation, usually takes a couple of weeks for Caroline to send that yes or no, approved or denied back. While you're waiting, the care manager can go ahead and start looking for service providers in the area that would meet those needs of the identified services from the assessment. So then you get the assessment back from Caroline, and it gives you an approval, and you're ready to move to the next step. So that's step number 4. And the care manager and the member and the person still start working together to select a provider for services, and then officially make that referral to the provider. And once the provider accepts the referral, the care manager then begins coordinating with the provider to gather their input for the care planning process. So that process of including the service provider in the care plan is really critical. It helps to make sure that that service provider's short-term goals are included in the big life plan, the care plan or ISP for the person for tailored care management. And then after the care plan has been completed or the ISP has been completed, then what will need to happen is everyone that was involved, the person or their legal guardian, the care manager, and the 1915I service provider will all need to sign that plan. And then that's going to move us into step 5. And then step 5 is the prior authorization process. And just a little caveat, some of the services do not require prior authorization, but that is based on each MCO tailored plan has a little bit of a different process on how you submit the information, even if it doesn't require prior authorization. So just going to give that little caveat here. So in the prior authorization process, the care manager will submit the care management comprehensive assessment, the 1915I assessment, and the care plan to the tailored plan via their portal or whatever method it is that they choose. And it's really important to complete this step as quickly as possible after receiving that approval from Caroline, because one of the requirements of the state plan amendment is that the services, the 1915I services, should begin within 60 days of that eligibility determination. So once all of the things have been submitted for the prior authorization, the tailored plan is going to review it, hopefully approve it, or they may not, and they may need some corrections made or some adjustments. And so that process kind of can go back and forth sometimes. But then once it's approved and they authorize the services, then that's when the care manager will make sure that everyone has a copy of the care plan. The service provider, the care manager, of course, the individual, everybody has a copy of the plan. And then that takes us to step 6. Step 6 is the service delivery and care coordination. And so after services are authorized, the care manager begins that monitoring process of the 1915I services. And it really is looking for, are the services being provided as outlined in the care plan or ISP? So the care manager is also going to provide ongoing care coordination. As a part of that service delivery, do other needs get identified and pop up? And the care manager needs to assist with coordinating those needs. Monitoring should occur at minimum of quarterly unless there's a relative as a provider. And in those situations, monitoring would be completed monthly. And then there's the annual piece of this. So annually, all of this process starts over again to be able to continue the 1959 services. And so you start with number 2 at that point, because you've already identified the need if they're getting the 1959 service. And so then every year you would start with number 2 and redo the assessment, have Caroline evaluate it for eligibility, and then connect the dots back to going all the way through that cycle. All right, so here's our information about the assessment. So the 1915I assessment is completed by the identified care manager, and it screens for a lot of different things: functional needs and daily living skills, health and safety considerations, behavioral health, cognitive functioning, community integration and social supports, service needs and goals. The 1915I assessment ranks the level of support needed in each of the areas. And the possible responses on that are assistance needed, none. So maybe they're good in that area. They don't need any extra support there. But it could be assistance needed, some. So they need just a small amount of support, or assistance needed total. And that's someone who needs a lot of additional support in that specific area. And each response has a comment section that you can provide additional information and details of the types of assistance needed, who provides that assistance to them, and any barriers that they've faced with that need. Next slide.
So to go into a little bit more detail about each service, I'm going to start with supported employment for people with intellectual and developmental disabilities and traumatic brain injury. So this is a service to help someone choose, acquire, and maintain a job. The criteria for age is 16 and up. They must have a diagnosis of intellectual or developmental disability, intellectual disability, a genetically diagnosed syndrome, example like Down syndrome, or a traumatic brain injury. And they need assistance to explore, seek, choose, acquire, maintain, or advance in competitive employment. This can also include self-employment. One thing to note, as Leigh had mentioned, this service does require prior approval, and the care manager will submit a care management comprehensive assessment, also known as the CMCA, a care plan or individual support plan known as the ISP, and a 1915I assessment to the tailored plan for that final approval.
Individual placement and support, or IPS. This is a service with a focus on employment and education for people with significant behavioral health needs, including mental illness or substance use disorders, who want to work. So it's for people who are ages 16 and older. They have a diagnosis of serious mental illness, SMI, serious and persistent mental illness, SPMI, or severe substance use disorder, SUD. And again, for the employment services, individual placement support, IPS, they have to have a desire to work. And they have an established pattern of unemployment or underemployment, or maybe they have educational goals that relate to employment, such as wanting to go back to school to get a specific type of certification so that they can do XYZ job. Prior approval is not required for this service. However, some of the MCO tailored plans do require us to send the care plan, ISP, and the 1959 assessment to them for review so that they have it on file to show that the service was needed and necessary, and they have that, kind of as a marker for that. The next one is individual transitional support, and that is also known as ITS. And it is a direct one-on-one service to support a person with serious mental illness or substance use disorder to improve the ability to manage daily activities of living. It's for ages 16 and older, and diagnoses can include serious mental illness, serious and persistent mental illness, serious emotional disorder for the younger population, or severe substance use disorder, SUD. And an individual has needs that are related to adaptive skills, employment, education, financial management, health management, housing, self-care, treatment, or medication adherence. And this is another one, prior approval is not required. However, if the tailored plans do want that information sent to them, they do have their own process, and it would be sending the care plan ISP and the 1959 assessment to the tailored plan.
Respite. So respite provides temporary periodic support for caregivers of people with IDD, mental illness, or substance use disorders. There is a certain age range. So 3 to 21 for those with mental illness or substance use disorder, or 3 and older with intellectual and developmental disabilities or a traumatic brain injury diagnosis. They must have one of those diagnoses to qualify for respite, but it does provide that supervision for the caregiver to have that periodic relief. And that support can be within the person's home. So the primary caregiver maybe can run errands or go out to lunch or a movie with a friend, knowing that they'll have support within the home. This support is available when no other natural supports or other relief are available. And note for respite, prior approval is required. So the care manager must submit that care management comprehensive assessment, the care plan or ISP, and 1959 assessment to the tailored plan for that final approval. Community living and supports is an individualized or can be a group service supporting individuals with intellectual and developmental disabilities, as well as traumatic brain injury, to live in their own home or their family's home and be actively engaged in their community. It is for individuals age 3 and older. They must have a diagnosis of intellectual or developmental disabilities, a genetically diagnosed syndrome such as Down syndrome, or a traumatic brain injury. And the service is for individuals who will benefit from skill acquisition, that skill building and development, and supervision to enhance independent living, community living, self-care, and self-determination, support for health conditions, daily living skills, and being an active participant within their community. Note that prior approval is required for community living and supports, and that means the care manager must submit that CMCA care plan, ISP, and that 1915I assessment to the tailored plan for final approval.
Community transition provides funding for one-time initial setup of expenses for someone that's transitioning from an institutional setting into their own apartment or home. It's for ages 18 and older, and the diagnoses that are included here are intellectual or developmental disabilities, serious mental illness, or severe substance use disorders. The individual is transitioning to an independent living setting, and they are now going to be responsible for their own living expenses in a home or an apartment, and it has to have either their name or their legal guardian's name on the lease. Prior approval is required for community transition. So the care manager must submit the Care Management Comprehensive Assessment, or the CMCA, the care plan or ISP, and the 1915I assessment to the tailored plan for prior approval.
Okay, at this time, we will open the floor for any questions that you may have. Feel free to drop your question in the chat and we will do our best to get to it. If for some reason we can't get to your question today, the presenter's info is at the bottom of the screen. We did have one question earlier. Do children in need of respite services have to receive respite in a licensed placement? Do respite services have a time limit?
There is a certain amount of hours for the year, and that would be based on the person's needs and submitting that through the tailored plan, so through working with the care manager. Now, respite does not need to be placed, if I understand the question, because respite can be done in the person's home.
All right, our next one is, what is the typical turnaround time for prior approvals?
So the tailored plan has, for prior approval from the tailored plan. All right, let's go through. Let's start with Carillon eligibility. Typically can take anywhere from 7 to 14 days to get that approval. Sometimes faster, just depending on. Once you get that eligibility, and then you're working on that plan to submit to the tailored plan, they do have a 14-day window to review and then either approve, deny, or ask for additional information. And then the team will work together if additional information is needed and submit that to the tailored plan.
Okay, thank you. Does autism and BPD diagnosis qualify for any of these services?
Yes.
The 1915I services, that those diagnoses do qualify for these services. And, I think we could go back maybe to that. Was there a slide that had
Back to the grid that had the
grid? Yeah. Let's see if it has. Yep. So this grid here will show you the diagnoses or the disability categories and which services the person would qualify for based on their disability type, and then the ones that have the age caveats.
Right. What if the person has IDD along with SCD, but no mental illness diagnosis? Do they still qualify for community transition?
Yes.
So I was looking at the grid.
Yes. And if someone is what they call dually diagnosed, and that may be they have an intellectual and developmental disability as well as behavioral health or substance use. They may be eligible for additional services because of that dually diagnosed.
All right. For community transition services, for people transitioning to their own home, would assistance with obtaining needed home modifications or assistive devices be available in transitioning from an institution to their own home?
I'm actually looking up the clinical coverage policy because that's a very detailed question. I want to make sure.
While you're looking that up, we'll jump to the next one. Are 1915I services classified as an enhanced service?
They're not. So there are certain services, just for the audience, there are certain services that are labeled as enhanced. 1915I is not part of those enhanced services. However, there are some things such as conflicts that may occur. For instance, if Monarch is the care manager for the person, we cannot also provide the service. Monarch is the agency. So there are some nuances that the care manager could certainly go over with a family or with that care meeting.
And Leigh, just let me know when you're ready to circle back. The next one is, can you please speak about CLFS services for IDD day programs? This service was not on the original rollout of tailored care or 1915I, but we have been able to admit individuals to IDD day programs with the CLFS service, but only with tailored care Medicaid.
So CLFS is not part of 1915I. It is a separate service through each of the tailored plans, and it would be part of their benefit package. And so that is an option with the tailored plans. And you're right, for those with tailored plan Medicaid, to request an additional service for day programs. That's correct. But it is not part of 1915I.
Okay, what is the effective date of the IPS? Is it the date of the client's date of birth?
I'm sorry, can you say that again?
Yeah, what is the effective date of the IPS? Is it the date of the client's date of birth?
So, if I'm understanding that question correctly, it's that for the plan period that includes the IPS service. So, our agency has selected to put people on that cycle of date of birth, for ease of tracking and monitoring and making sure that we get all of these requirements done at the right intervals and ahead of the time of them, because we don't want people to lapse in services. We want to make sure that people are able to continue with services. And so that is what our agency has chosen to do. I know that other agencies have done it differently. And so, Anna, anything else to add to that?
I would just add, if we're looking at maybe a job to start, or when things are, when the provider is ready, the person's ready to begin, it really is just setting that date to that time. We do go by birth months, really. It's really for organizational purposes, to keep us on track, but it doesn't necessarily have to be at that time.
All right. Is it correct that if someone only has a mental health diagnosis, they would not qualify for CLS?
That's correct. But they would qualify for individual and transitional supports.
Right.
All right. I need 1915I. How do I go about obtaining one? Contact the care manager. That's a question. Would I contact the care manager?
Yes, the care manager is going to be your access point getting connected to 1915I services.
Okay. Next is, would you explain in more detail the types of assistance provided with individual and transitional support services?
Do you want me to take that one, or you got it?
Yes.
Individual and transitional supports. Maybe one more.
One more.
So individual and transitional supports are for individuals that, due to that serious mental illness, it may be schizophrenia or identifying where the service may debilitate certain skills that they had at one time. So, for instance, managing a budget, or if they have maybe a physical health condition as well as their mental illness, and maybe someone has diabetes and really need help in identifying how to create that grocery list to make sure they're getting the right foods or staying within that budget, to going to the grocery store, or if they have a job, really working with them to make sure that that budget meets the needs for them throughout the month, throughout the week. But it is helping them gain those skills that, because of their diagnosis, may have certain issues or needs in that area. That hopefully that helped.
Okay. If the individual is approved for 1915I services, what would be the hours of services?
That really can vary based on the needs of the person and the service type that they are approved for. So that really varies, and those types of nuanced details are part of that care planning process when the care manager is working with the service provider to figure out what type of support the person needs. They're really all working together and collaborating during that care planning process to figure out, okay, if they qualify for CLS and they have a functional deficit and they can benefit from those skill acquisitions, how much support is needed. So remember, on that 1959 assessment, it talks about whether they need no support or some support or total support. And ranking someone higher up at total support may mean that they need more hours in their day or in their week for a specific service within the boundaries of the service definition criteria for each of those different services.
Okay. Does diagnosed ADHD qualify as a developmental disability with the IDD eligibility for services?
No.
Okay.
It's going to be on the behavioral health side, the SED side.
All right. You expressed that authorization process would occur annually. However, when submitting 1915I services, I have observed that the authorizations are only being authorized for as long as their insurance is valid for, and not for the entire annual date, which was requested. Is there a way to have these aligned so that 1915I services are able to be authorized for a full year when requested?
I think this speaks to some of the nuances between some of the different tailored plans. At this question specifically, we've had similar situations like that as well. And so what we do is we try to work with the tailored plan to figure out the dates and get it to align as much as possible. The Carillon process, the eligibility process, eligibility is good for a full year. However, if their Medicaid is only active for 6 more months, then that's a conversation with the tailored plan and trying to sort through those nuances. But a reminder is even though the Carillon eligibility is good for a full year, services should begin within 60 days of that approval from Carillon. So it really kind of pushes the clock there to go ahead and select a provider, get the care plan completed, get the authorization from the tailored plan so that services can actually start within that 60-day time frame.
Okay, and this one is actually circling back to a previous question asked. They said they asked it in the wrong way. So if a member is IDD, has SED, and also adult, do they still qualify for ITS? So they have IDD, have SED, and are adult. Do they qualify for ITS?
So the criteria for ITS is that the SED diagnosis is ages 16 to 21. And then the adult range diagnoses for ITS, individual and transitional support, are SMI or SUD. So severe mental illness or serious mental illness, excuse me, would qualify for that.
Okay. If respite is provided to a child in an AFL, does it have to be licensed?
I would refer that answer to the tailored plan.
Okay. What does SED stand for?
SED stands for serious emotional disturbances. And I know we and in our field throw a lot of acronyms around. So in each of our slides, we hopefully have done a good job of spelling those out in each of the slides so that when you do get the slide deck, you'll have that to refer back to.
How do these transition services interact with money follows the person?
So 1959 services are available for those that are waiting for additional, whether it's a waiver, innovations. For those in money follows the person coming out of, an institution into a community setting, those services are covered through money follows the person. If you were on, and I'm not sure if we mentioned this, but if you were on the wait list for innovations, you can still get 1915I services until a slot is available on innovations. It doesn't affect you on that wait list. It won't change your spot on the wait list. But these services were really put in place so that those that didn't have anything while they were waiting for other services now have something available while they're waiting for additional service and supports.
Okay, and as a follow-up to that, as an example, can home modifications be obtained through both?
That would be through money follows the person.
Okay, and we actually do not have any more right now. So if you do have a question, please put it in within the next few minutes so we can get that answered. We'll give it about 2 minutes. And if there's no questions, then I will move to the next slide.
May I add one thing?
Mm-hmm.
while we're waiting on if there is a question, one thing to note is if you are a parent or a person interested in the services, do hope this has helped, and reaching out to that care manager or to the tailored plan if needing assistance, of really sharing some really great needed services within North Carolina. If you are a care manager, we are in this together, and knowing new services, having that process can be difficult at times. And I would encourage, if questions are unsure, reach out to your provider groups. We are available, as well as your tailored plans, because the one great thing is we now have these services available to people that we did not have before, that we could offer as support. Community, reach out to your tailored plans to gain the information. And if you know of someone, certainly encourage reaching out to the tailored plan to see if they can get additional services.
All right, we have a couple more that came in.
Okay.
Who determines the amount of hours for respite?
So when you are sitting down with that care plan meeting, and this may include the family, the person, maybe the family or the person wants to have others involved in that meeting, can be a neighbor or a family or another family member, the care manager, and then that provider. You want the provider that's been selected that's going to provide the services at that meeting. And you'll have a discussion of looking at what type of relief do you need. And it may be a discussion of talking about how much would you need each month? Or are there certain times of the year where maybe you need more? There have been a couple families that we've worked with that they're not sure. In talking about services, I don't know about a stranger coming into my home, or, how am I going to leave someone with my child and know that they're safe? So they may start with a very small number. And as they see that this is working, it may be, okay, I want to add more. And it really is based on the need of that person and requesting that through the tailored plan.
Okay. Is there a workaround for people who do not have active Medicaid due to inpatient hospitalization at a psych facility, but need 1959 services upon discharge or community transition?
So the 1959 services are Medicaid services. So it is a requirement that the person has active Medicaid. So that process wouldn't start until their Medicaid is reactivated. But that's where the transition process from the hospital to back into the community, it'll be really important to, a lot of times they may know who they want as their care management agency, so you can warm hand off additional information so that provider can already have some kind of front end information to go ahead and get started and do that assessment as soon as they get connected with them for tailored care management.
All right. So we are at 12:50, so we're going to go ahead and start wrapping things up. But just as a reminder, these slides will be available, and this presentation will also be made available on our website, monarchnc.org. You can also scan this QR code, and it will take you directly to the website. Just give us a few hours to be able to wrap everything up and put it on there. Okay, so we are excited to be offering these Lunch and Learn webinars. This is actually the second one we've done. If you're interested, we've done one on the innovations waiver. But if you have a topic you'd like to see us cover in a future session, please scan the QR code or visit this link. You can click on when we post the slides. But please share your suggestions with us. We want to know what everyone's questions are, what topics people want to see covered. So just scan that QR code or go to that link, and there's a short survey that just straight asks you, what suggestions do you have? And if you do have any questions or have any follow-up information that's not available in that survey, my name is Jen Gallimore again, and I'm the Director of Communications and Public Relations. So I help manage our marketing efforts, and we're happy in this department to be able to bring this Lunch and Learn series to you. So without further ado, I believe we can wrap up for the day, unless Anna or Leigh, you have any additional comments you want to leave anyone with.
One thing wanted to add is the North Carolina Department of Health and Human Services has put out some really great flyers, some social media information, and we'll also include that information so that you can have that if you want to download a flyer to give to a family or friend. Thank you.
All right. Thanks again, everyone, for being here, and be on the lookout for a follow-up email, and it will have the links that we've talked about today, so you can access those easily. Thanks so much and have a good day.